at this image, do you see these tiny white specks? That is cancer. There's no lump, no bump, just a few scattered dots. And most women would never know they were there. In fact, 1 in 8 women will be diagnosed with breast cancer in their lifetime, and many of them will never have a single symptom until it's far too late. But here's the truth. A simple 5-minute habit could save your life. What is early detection, and why does it matter? Early detection means finding cancer before it has a chance to grow or spread. It's about catching it while it's still small, local, and most treatable. The earlier we catch breast cancer, the simpler the treatment, the better the outcomes, and often the fewer the side effects. Here's something that's scary. Many early-stage cancers do not cause pain or even visual changes. Imagine a scenario where we had a warning bell that could signal a change in our breasts to indicate that one may have early breast cancer. A mammogram is that warning bell. It is the only way we are able to see these small calcifications. So how do mammograms work? And what exactly are we looking for? A mammogram is a specialized x-ray of the breast that can detect changes long before you'd ever notice them yourself. When the x-ray passes through your breast, we get an image that has lots of shades between white and black, a lot of gray in between. If you have calcifications, less of the x-ray is able to get through the tissue, and so we see it as white. Most people can relate to this image. Bone is hard, so it appears white on an x-ray because it's hard for x-rays to go through it. On the other hand, if there's fat, the tissue appears darker because it's easier for x-rays to pass through. This contrast between the different kinds of tissues helps us as radiologists find things like tumors, cysts, or calcifications, those tiny white mineral deposits that can be an early warning sign of cancer. These will all appear as white or bright. Most calcifications are totally harmless. But when they appear in certain patterns or clusters or shapes, they raise a red flag for us. In some cases, those clusters are the first signs of cancer. We refer to this as precancers, DCIS or LCIS, ductal or lobular carcinoma in situ. At this stage, the cancer hasn't spread. In fact, the survival rate of people with early breast cancer is close to 100%. This seems like such a great thing, simple, beneficial, helpful, and yet a lot of women question mammograms and are hung up on the fact that mammograms use radiation. Understandably so. I want to acknowledge this as a valid concern. So let's talk about it. Yes, mammograms do use radiation, a very small dose. It's about the same amount of radiation you'd naturally get just from living on Earth for 7 weeks. We get radiation from different sources daily, such as from food and flying. A person might think that, well, that radiation is unavoidable, and I would agree. However, the benefits of screening far outweigh the risk, especially when you're over 40 and if you have other factors. That amount is so low. Remember, mammograms aren't here to replace self-breast checks or breast awareness. They're part of the team. The knowledge of your body paired with imaging gives you the best possible defense. So you've done it. You've gone, you've got your mammogram. Congratulations. You'll receive your report, and you may need help understanding what's in it. To help you feel more confident and less overwhelmed, here are a few key items to look out for. First, the BI-RADS score. This is a standardized language system that radiologists use to describe what they see. It ranges from 0 to 6. 0 means more images or information is needed. 1 means normal. 2 means benign. 3 means probably benign, with a follow-up suggested usually in 6 months. It's a less than 2% chance of a malignancy. 4 and 5 means suspicious, likely cancer. 4 is a 2 to 94% chance of malignancy, and 5 is an over 94% chance of malignancy. 6 means that there's a malignancy, no. Now, these numbers can sound intimidating, but remember that most mammograms come back as BI-RADS 1 and 2. You might also see words like calcifications, masses, or asymmetries. What do they mean? Calcifications are the tiny white specks we talked about earlier. They don't always mean it's cancer. Masses are areas of denser tissue. They may be benign, or they may need more imaging, or testing, or follow-up to see if it's okay. Asymmetry just means one side looks different from the other. It's not always a problem, but it may also need more imaging or testing. If anything is unclear, ask your provider to walk you through it. You deserve to understand what's happening to your body. That's right, you deserve it. So how can you actually catch breast cancer early? There are 3 key ways. Number 1, regular mammograms. If you're at average risk, start at age 40. The most lives are saved starting at age 40 and getting it yearly. The practice in your country, or if you're in Canada, at this time, the practice in your province may vary from one to the other. Mammograms are the gold standard, especially for spotting early stage cancers that don't form lumps. But if you have a family history of breast cancer or ovarian cancer, or you carry the BRCA gene mutation, you will need to start earlier. Mammograms at age 30 and MRI starting at age 25. Talk to your doctor. Together you can figure out the best plan for you because personalized screening is smart screening. Number 2, be breast aware. Know what's normal for your breasts. That includes shape, size, skin texture, sensation. Are there any rashes? Check in regularly. Nobody should know your body better than you. Number 3, self and clinical breast exams. Monthly self-checks can help you recognize changes. Clinical exams with your healthcare provider are an additional layer of protection, especially between mammogram appointments. So why don't more people get screened? Some think, I feel fine. Others believe they're too young, too busy, or honestly, too scared. Breast cancer doesn't care how old you are. It doesn't care what race you are or how scared you are, and it doesn't wait till you show up. It doesn't always give you a warning. Take 5 minutes to schedule that mammogram or do that self-check. It is so much easier than facing months of treatment later. Here's what you can do today. Schedule your mammogram. Do a self-check. Start a conversation with someone you love. Breast cancer is common, but early detection changes everything. And sometimes sharing this video could be the nudge someone else needs. If you found this video informative, please do me a favor. Please like, comment, and subscribe for more content that helps you understand your body and take charge of your health. Remember, early detection is the best protection. I'm Dr. Ify, and thank you for watching.